it can create some panic, a lot of anxiety. Individuals, families who have planned, who have recognized decisions that needed to be made, goals that needed to be established, will in general, not always, I would say fare much better as we really move towards the end of life. A lot of decisions, financial and otherwise, need to be made typically. And individuals who plan accordingly tend to have a better end of life. But unfortunately, we live in a society where there's not a lot of proactive planning around that.
Hey! It's a new season where we're still alive. And so is public health. I'm Jonathan Lyle Sexton. Welcome to Better Together. Welcome to another season of Better Together. We're so hyped to be back, and we took times off just to refresh ourselves, learn lessons from our first season, and there were a lot of lessons that we took. One of them for me is to learn how to pronounce the guest name before they get on set. Today we are going to be talking about comfort for families dealing with loss. Grieving takes time. We all know that. There are 5 stages, and for some it takes longer than others. When a family member, whether by blood or chosen, is hurting, we all hurt. Loss can take a while. You may know months or years ahead of time that the end is near. Today's guest has just taken the helm of an organization that is there in that time, there to help take care and lighten the load. Because when someone can ease that burden of the last few months of someone's life and take on that caregiver role, the family caregivers drop the caregiver and become just family again. The time becomes meaningful, intentional, and we become available to just love those we care for most. Granite VNA helps with this exact issue. They are New Hampshire's largest nonprofit home health and hospice agency. While it may seem like grim work that they are doing, it really makes an impact. So here's my conversation with today's guest. You know that feeling when someone retires after a decade of running things, and instead of bringing in someone who has to learn everything from the ground up, the organization just calls the guy who used to work there and is already really good at it? Well, that's Granite VNA's moves, and today you're going to meet Jim Culhane, their brand new president and CEO, who is, and he has heard this probably many times in the last few months, returning to the exact organization he left over a decade ago to run someone else's nonprofit. Very left myself to find myself, but I came back with a nice resume. So Jim spent those 11 years at Lake Sunapee Regional VNA and Hospice, where he did the unglamorous, extremely hard work of merging organizations, surviving a pandemic, and expanding the hospice and home care access across 3 counties, all while presumably someone just kept saying, when are you going to come back to Concord? And now he's back, running the agency that's been here keeping people cared for in their own homes since 1899, which, for context, is before I was born, before radio, before Fenway Park, before the Titanic, before the movie Titanic, and before basically anything you'd call modern healthcare. So today, let's talk about home health, hospice, what it actually takes to advance a powerhouse of an organization such as his, and why a guy with a master's in social work ends up just approving budgets for a living. Thanks for being here, Jim.
Thanks, Jonathan. I appreciate it.
You want to just start out by telling us a little bit about what you're bringing to Granite VNA, and also just a little bit about what Granite VNA does.
Yeah, absolutely. So I've been in the home care hospice space for about 25 years, and you gave a little bit of a summary of some of my previous roles, some of the glamorous life that I've lived. But home care and hospice services are mission-oriented services that are near and dear to my heart, meaning I think they fulfill a critical agency, or I should say a critical public mission in terms of the communities we serve. Home care services, very briefly, are really services that are geared towards helping people recover from illness, injury, hospitalization, nursing, physical therapy, occupational therapy, helping people get back to some level of living. Hospice services, obviously, for the majority of people are well aware that's for people. It's for individuals and services that are for people for the end of life. And it's for individuals to help them stay comfortable and stay in their home. Our primary mission at Granite VNA is to help people stay in the location that they choose, and that's most typically their home. And that's primarily what our focus and goal is in all of the services we provide.
Yeah. So what all is your experience like? What got you into this line of work? It's not an easy one that you just wake up when you're 5 years old saying, you know what, I want to go into this line of work.
Yeah, that's a good question. So we'd be going back, sadly, 25 years ago. And I began working for what had been Concord Regional Visiting Nurse Association at the time. And I was a liaison. And the liaison was, and still is, a responsibility set that includes really partnering with another institution. In my case, it was Concord Hospital, and acting as a go-between between the hospital and the VNA in order to improve services, improve communication, as well as to kind of ensure that the hospital has a thorough understanding of what we do, and to support that hospital in terms of their needs as well. So that began my career with home care and hospice, and then that moved into really management, and I became a home care and ultimately a hospice manager, and then on up the chain, so to speak. And I've always found it to be an appealing mission. I think it's true of any type of organization, or even a for-profit company, which is, you feel good if you have a product that's really deliverable and really well received and is needed. And when you have a product such as home care and hospice that we continue to run, and we continue to want to provide more of because it continues to be underutilized, then, you're kind of in a good place. It's an easy drive into work when you're representing and supporting a product, for lack of a better word, that is needed and demanded in the community. And that's I recognized that really early on, and then I guess I would say I've been blessed to work with a lot of good people over the years that have slowly but surely supported me as I've moved up from one level to another, until roughly 11 plus years ago, I became a CEO of Lake Sunapee Visiting Nurse Association, which is a great organization out of New London. And that continued my upward trajectory. And then, more recently, as you had stated, moving back home, because this is where I'd started. Granite VNA's previous name was Concord VNA, and when they merged with Central New Hampshire VNA about 5 years ago. And it was a nice return back to really where I began. Yeah. And it was really nice to walk in the building and see a lot of familiar faces. That was helpful. A lot of good people that I had worked with still remain there, so that was a helpful transition as well. So so it's been it's a never-ending onward growth opportunity for me, and I'm pleased and proud and frankly flattered that some people who I'll assume are wiser than me thought it was a good idea for me to step into this role.
I think they made the right choice. And when people often think about hospice care and in-home health care, what are some of the things that you hear from the community that you just wish you could be like, okay, let's reframe this, let's refocus this, right?
Yeah. So I would say that question, it applies both to home care and hospice. I would say more consistently and more frequently is hospice services. Hospice services, it has a very general criteria in terms of how an individual qualifies for hospice services, and this is coming out of general Medicare regulations, is that the individual in his or her provider's medical opinion has less than 6 months less to live. And it sounds specific. It's not. It's rather vague, and because there's no crystal ball and it's hard to predict, how someone proceeds, whatever the disease process they have. But we live in a culture, Jonathan, that we don't and are not very proactive in predicting our own demise. Yeah. So as such, we live in a society that does not think very far into the future and does not think about when and how we may end. To my knowledge, I think virtually everybody dies, to my knowledge. Yet we as a culture don't do a great job in planning for that ending. So unfortunately, what we find out is and when people are offered hospice services, it at times comes as a surprise to them. And that surprise is, again, I think that's just a reflection of the culture that we live in. But because of that, it can create some panic, a lot of anxiety. Individuals, families who have planned, who have recognized decisions that needed to be made, goals that needed to be established, will in general, not always, I would say fare much better as we really move towards the end of life. A lot of decisions, financial, and otherwise need to be made typically. And individuals who plan accordingly tend to have a better end of life. But unfortunately, we live in a society where there's not a lot of proactive planning around that. So there's a lot of panic, anxiety, and quick scrambling as to what is and what is not needed to be done.
Which doesn't make the grief process any easier.
No, can be much more complicated. Yeah.
Exactly. When there's a lot of anxiety and you're already dealing with pain. You're already dealing with loss and suffering. And, you know, whether it's a 6-month runway, some people get years, you know, like no matter what it is, there's that runway that you're already dealing with loss. And if you're scrambling then on top of that to make all the final preparations, get all this other stuff done, there's very little moments to just be human and be back with your...
That's exactly right. And really one of the core missions of hospice is to provide services to individuals and their families to help them certainly be comfortable, to mitigate or eliminate side effects of either the disease process or whatnot. But it's also to provide a layer of support for the patient and the family to process what's going on and what's happening, and to help make decisions in those times. And, you know, it's an extraordinarily valuable service. But the reality is, you know, it is at times for individuals, I think a common misunderstanding about hospice operates is that when an individual is admitted to hospice and they're going to remain at home, that they're going to have an extensive support network of nurses, home health aides, homemakers, whatnot, that comes in. And the reality is that's not how hospice operates. We're largely a supportive organization, and our primary responsibility is to support the patient and the family to take care of their individual in their home. So I think at times we run up against misinformation of what the purpose or the scope of hospice actually is. I don't mind sharing as well that, you know, sometimes people think of hospice negatively, and they think of hospice negatively as some sort of program that facilitates demise and death. That is not at all what hospice is. We are not in any way short in the business of hastening anyone's
That was going to be my next question is how much do you guys charge to watch everybody die?
It's, you know, our job is to create an experience that the patient and the family would like to experience in the place where they'd like to have it, which is most frequently in their home setting. And our job is to support them in their goals in terms of not only just staying home, but to navigate the very, very, very complex period of end of life. And that is our job. And a component of that is certainly in managing or mitigating side effects or discomfort, such as pain or respiratory issues. But really our job is to support the patient and the family to really, you know, be comfortable, remain where they are, and meet the goals that they've set.
I think it's really reassuring to just hear the emphasis on the family and the patient and the clients that you're serving, but to make sure that everybody gets this process a little bit easier. Because again, not an easy process whatsoever.
No, you're right. Yep, you're right. Yeah, the family is a core focus. Needless to say, in the majority of the settings we work, the family is the support. They are the caregivers. And that family, you know, it varies. Sometimes the family is just an 85-year-old woman taking care of her 85-year-old husband who's failing. Other times, as you, I'm sure, could guess, we have 12 children, you know, 6 of whom live local, 6 of whom live all over the world. And that's the caregiving unit that we need to navigate. But regardless of whether it's 1 or 20 people in that role, one of our primary responsibilities is to support that caregiving unit, to support that family.
How do your nurses come in when they're dealing with that preset family caregiving unit and like they're just kind of having to insert themselves in that whole, how do they navigate those challenges?
So it's, you know, I'll go back to something that you had said, which is, you know, people experience grief very differently. You can have a family of six children, and each of those 6 children has a different processing, you know, the processing, the decline of their mother, father, brother, sister, whatnot, differently. So it requires a fair amount of delicate diplomacy. It's no doubt about that. When you have larger families, you can say that the pro of having a larger family is you have a deeper, more robust caregiving unit. On the flip side, you can have a much more diverse set of understandings as to what the end of life may look like for an individual. So you have to navigate and be where the person is, and that if you have 6 or 7 people you're working with, then you have to deal with the complexity of being where the person is with 6 or 7 individuals. That's the only way you're successful. And and I know that doesn't necessarily mean that everybody is on the same page and that every family member gets along.
Yeah.
We can all probably relate into our own personal lives, so that a complex, high stress situation such as the end of life can cause a lot of stress amongst the siblings.
Oh, yeah.
And as such, our role, whether it be nursing, whether it be spiritual care, whether it be social work, is really to support them on their individual journeys as well as support the caregiving unit itself. So it's complex, but there's a lot of good people that do that work.
It sounds like it would be one heck of a road to navigate. Like,
it can be.
Yeah. And I'm sure that over your years, some stories have trickled up to you. Do any stick out over the years of just maybe some siblings who really had very vastly different opinions, or
sure.
just like family in general?
Yeah. Oh, sure. Yeah. Yeah. There's I'm not sure what your schedule is for the remainder of the summer, but sure. But, I think, the more, I don't want to say extreme, but I've seen this on more than one occasion, is you can literally have a sibling who fully is cognizant that mom or dad has days to live. And you can have a sibling that does not believe that mom or dad is dying or is declining at all. So you can have either end of the spectrum of someone is declining, someone is not. And even in the face of what I would say is very clear information that the person's death may be imminent, you can have siblings who, or not just siblings, but family members and whatnot, fully deny that that's a reality. Yeah. And that too is a form of what we call complicated grief, right? Which is even contrary to the obvious indications and what you're witnessing, people can still hold on to what they feel they need to hold on to. And that can create a very complicated grief and processing situation that we need to be attuned to, because you could argue an individual who maintains that belief that mom or dad is not dying at all, despite the information in front of you, is going to have a difficult time. A much more difficult time processing that in the days and weeks ahead than, say, the sibling who has been hand-holding, sitting bedside, and has been fully processing the decline of their family member. So that's the dynamic we work in. That's the specialty of some of the staff that we have on service. Social work, spiritual care, and the nurses do a lot of work in that domain. But you can see, and if you can imagine a reaction of a family member, it's happened in hospice. It's happened. And why? I'll come back to what I said earlier. We have an interesting cultural belief of what death is, and everybody has a very different perspective. Some, I would say, are healthy and positive, and some are not. And you see that come to fruition in family dynamics at times as well.
Awesome. To kind of like shift a little bit, nonprofits, as Granite VNA is, have been dealing with a lot of shaky funding lately.
Sure.
How much of your work at Granite VNA is state, federal funding?
Yeah.
Is it all fee-for-service type of work? But just in that perspective, how has Granite VNA been navigating the treacherous waters lately?
Yeah, it has been extraordinarily complex, and I'll say a few things before I give you a lengthy answer because I could talk about this for some time. Our primary work is focused on supporting hospitals to some extent, not exclusively, but so we support Concord Hospital Laconia. They sadly will probably be feeling the reimbursement changes much more aggressively, much sooner than we will, and that's for a variety of reasons. But the primary reason is the bulk of the people that we service are on Medicare or Medicare Advantage plans. Because we serve people later in life, majority of our patients, clear majority of our patients, are over age 65. So as such, I'll say that for a moment, positively, which is the high number of patients that we service are over age 65, so they qualify for Medicare.
Yeah.
And I say that because Medicare has not been impacted. Medicare in the Medicare program has been less impacted by regulatory and fiscal changes than Medicaid.
Mm-hmm.
Medicaid, for those who don't know, is for individuals who either have it's primarily means tested. It's a financial consideration whether you qualify for Medicaid or not. There's some other categories as well, but that's the general gist of it. That program is probably is approaching decimated in terms of some of the.
It's feeling it a lot.
It's going to get substantially worse. And it's going to get substantially worse for the patients that are under age 65 that need Medicaid. It's going to get substantially worse for the programs and facilities such as hospitals that they do not have the luxury of turning a patient away. So if an individual comes in with no insurance because their Medicaid ended, they are still required to provide a high level of care to that individual. And when you're talking about an uninsured rate because of Medicaid changes growing substantially from 2, 4, 6, 8, 10, 12%, you're talking about a substantial financial burden that certain health systems are going to have to endure. We're currently a little insulated from that because the percent population of individuals we see with Medicaid or no insurance is relatively small because we tend to see an older population.
Yeah.
We tend to see people over our average age is closer to 70. So because of that, our primary payer is Medicare or Medicare Advantage programs. Not exclusively. We see all insurances, and we certainly see individuals with Medicaid, and we certainly see people who have no insurance. But the disproportionate amount of work we do is with individuals who have Medicare or Medicare Advantage. So the impact of Medicaid cuts, while will be noticeable, will not be as substantial as other healthcare systems' impact, unfortunately, for them. That having been said, there's a downstream impact, which is we partner with Concord Hospital, Laconia. They are our partners, and if they have stress associated with their patient population and their payer mix, then that does roll downhill, and we will see an increase of patients that don't have insurance and an increase of patients. So it is a very unfortunate trajectory that we're currently on that has raised a lot of concerns about what healthcare will look like in the state. But for now, the VNA has some level of insulation given the primary payer we work with is Medicare and Medicare Advantage, and that tends to be okay for us right now.
It's very interesting to think about how decisions made about a select population, right, and the cuts made to those programs, then ripple out, drops in the water, where you're starting to get waves because of it, and how long do you think it will take for it to? Do you think, in the grand scheme of 10, 15 years, like, is it a couple of years? Is it many years?
I'd say in 3 to 5 years, you're going to see a substantial amount of stress on, and again, I'll use hospital systems. And I'll say rural hospital systems who would disproportionately service individuals with Medicaid.
1,000%.
So no, I think it's a much sooner impact than 10 or 15. In 3 to 5 years, there are going to be some legitimate conversations about the viability of some health systems in the state because they cannot incur that level of loss financially without some sort of offset, whatever that might mean. The reality or the mistaken belief that we're eliminating and putting cuts in Medicaid in place cuts healthcare costs is short-sighted and inaccurate, and that's been proven time and time again. Individuals who don't have medical insurance still use medical services. And they just use them at a more expensive level. And we, as a not-for-profit, are still obligated to see them, as we should, as a mission-oriented organization. But we, even if we're less impacted and more insulated than healthcare systems, we too have a limit to the level of loss we can incur financially from non-paying patients. That's the reality of it. We try to make up losses financially through a variety of means, such as donations and so on. But the reality is we have a limit. and we do not have a never-ending, concept of financial loss we can incur. It's just not feasible. And again, I would say we're in a better place than other systems. So I'd be surprised if in 3 to 5 years you're not continuing to see it on the front page of newspapers that the financial stress that health systems are suffering through will require some address. Otherwise, there'll be some fundamental changes to how care is provided in communities.
It's absolutely just like to think that far ahead, and to think about what some of the effects of what's happening currently are going to lead to is just it's disheartening.
Yeah, it's unfortunate.
And when you're not ripping your hair out from Medicaid cuts and thinking about all of this, what are some of the things you like to do just in your personal time to keep a little bit of sanity in there, because we all need that right now.
Yeah. So that's a great question, Jonathan. So, there's a lot of things I try to do outside life. I guess I would say, first and foremost, I try to exercise, right? Which is always it's always funny to me. I've been a runner on and off my entire life. And you arrive at an age, you're trying to decide, is running, is it helping and decompressing, or is it adding stress to my life? Because I certainly don't run like I used to 20 years ago. So I try to keep active. For me, that's an important part of my life. I have other activities. We had a quick sidebar before we started talking. I do play music. I play drums. I qualify all that by saying not well, but it's fun. And I think there's a lot of activities that a lot of people undertake solely to, get into kind of a special place of carving out the stresses of life and just being able to focus, kind of have a unitary focus on something. And for me, sometimes music plays that role. So I have a 17-year-old daughter. She has a substantially greater social life than I do. And because of that, she keeps me busy.
Yeah.
It's always a challenge, to balance work and life.
Oh.
I guess I would say I feel blessed, and I think I have felt blessed for some years that I've always really enjoyed driving into work. So I've never, it's been years and years since I have felt the grueling aspect of, and the stress associated with
work today.
Yeah, right. I mean, we've all had jobs that, hopefully in our distant past where, we dreaded going into work, and blessedly, I don't live that life.
Yeah.
What I feel is, what I think is to some level fulfilling to me is the work I'm doing at the VNA, which is there's always projects, there's always paths, there's always needs that are going unmet in the communities. So what are the creative solutions we can put in place?
Yeah.
What are the resources we have in order to put those solutions in place? That's kind of the puzzle that a lot of us at the VNA work on. And I find that enjoyable. So while I'm not going to say work isn't stressful at times, it is.
It always
is. And that's not to say if I won $1 billion lottery tomorrow, I wouldn't be telecommuting from a tropical island somewhere.
As we all would.
Exactly. But I feel as if I'm blessed in that I'm in a great mission-oriented organization that is meeting needs of mine personally, but for the communities as well, which is nice.
I really appreciate the fact that even it's a very small thing, but in your $1 billion lottery scenario, you're still working. You're just working.
Yeah.
You're still doing what you want to do.
Though. Yeah. Right. It's from a beach.
Which we all would understand, right? You probably lower your salary a little bit.
Right.
But
exactly.
Still, you're still doing the work. And that really, I think that really categorizes who you are as a person. And that tells a lot. Before we get you out of here, I have a few rapid fire questions.
Sure.
So, what's one word to describe your work?
Oh, fulfilling.
Fulfilling. Boom. Best place in New Hampshire.
Oh, geez. Well,
this is the one that gets everybody.
I live in Henniker, and I love Henniker, but boy, there's some beautiful places in New Hampshire, right? So that'd be hard. I certainly love the seacoast. I love the mountains. I love the lakes. I have fond childhood memories of Weirs Beach. So it's I would say it would be hard for me to pinpoint any one particular location.
That's what everybody deals with here, because New Hampshire is a state that you just get to say, put this geographical type here: forest, mountain, lake.
Yeah.
It has it. Ocean.
Yeah.
Got it.
You're an hour from everything.
Exactly.
Basically, and I don't go into the city or go into Boston too much anymore, but it's nice to have it.
Exactly.
It's nice to be, nice to have it nearby.
When the Red Sox are hot, it's nice to go down and catch a game.
Right, exactly. I'm suddenly a fan again.
Exactly.
Right.
Crazy how that one works. Are you a podcast or a playlist person on your commutes?
Oh, I am. I actually split time between both, and I'll explain why. I like podcasts. Sadly, I tend to listen, and my interests are in politics. And after a short period of time, I tend to get stressed by the political podcast, and I have to move to my playlist. So
Turn that one off.
That's usually, I have to save myself from my own podcast, stress in politics, and I move to my playlist.
That is exactly how I am on my commutes. I got about 35-minute drive. So it's like I'm listening to a podcast the whole time, and then every once in a while I'm like, I have 20 more minutes of listening to this.
I can't do this. I am aging prematurely listening to this political conversation.
Exactly.
I need to put on music. So that's a good question.
Calming, nice
That's
music.
right.
Do you have a go-to desk snack?
Oh, geez. This is funny because so when I first started at Granite VNA, and this applies to my previous work as well, there was a running joke. I'm sadly a big snacker at work, and that's probably, there's a habit I could change. So when I first started at Granite, I made the mistaken, although dear to my heart, statement that I like Coca-Cola and Oreo cookies. So literally upon walking in, a number of people, and not the least of which was some of the staff and the HR VP, had Coca-Cola and Oreo cookies ready for me. So they are currently on my desk right now. So I'd like to say my snacking is healthy, and sure, I eat a banana or I eat nuts.
Sure.
But I'm sad to say if you came in and opened my drawers,
Oreos
you'd see
and
double stuffed Oreos. Double stuffed Oreos, unfortunately.
I love that. I am a big sesame stick person.
Oh,
so
sure,
it's not
sure. Yeah.
It's not great for you.
And
we all have those things. You gotta get the sweets in there.
Absolutely. I mean, and Coca-Cola, I have a long-term,
Dr. Pepper is my thing.
Love-hate relationship, right? Which is, we all work in, understand the healthcare space. I cannot defend Coca-Cola in any way, shape, or form, but boy, is it nice to have once in a while.
Nice cold one on a hot day.
Exactly.
Can't beat it. Are you a campfire person or front porch if you just had an evening to relax?
Oh, I got campfires. I have a campfire in the back. Yeah. If I can. My daughter, thankfully, has taken on that tradition of setting the fire up out back. The issue is she's a little less savvy to things such as fire restrictions, which we've come to learn in the last year, and the fire department's restrictions. So we've had to learn that the hard way with recognizing that you just can't set a fire when you want to when we're in a drought condition.
Crazy how that one works.
Yeah, it is. It's funny how that works. Thankfully, we did not burn down the neighborhood. That would have been a tough conversation. But yeah, no, that'd be my preference. So don't do it as often as I'd like.
Do you have a favorite color?
Yeah, I don't know. That's a good question. I guess I've always liked green, although I have to say, 80% of my wardrobe is blue. So, but that's probably more a reflection of men's fashion.
Blue is my thing. Yeah.
It's all some shade of blue. I'd say blue or green probably fulfill that. Yeah.
I'm a purple person. So yeah. Last question. What gives you hope?
Oh, I work with some great people. And even though we have things to fix and processes to change and plans to put in place for what we want to be in 2 or 5 years, it is super fulfilling and supporting for me to hear the passion that some of the people I work with kind of put out there, that what we want to achieve, what we want to do for the patients. And I'll tell you, that's it sounds trite, or it sounds, like I'm being, a little bit too mushy, I guess, but it is really fulfilling to me to hear, the passion of some of the managers, directors, whatnot that I work with that talk exclusively about how can we make things better.
Yeah.
And, that's not universal. It's certainly not universal, even in the healthcare industry. But I would say it's a rewarding part of my job. And when I first started at Granite VNA, I had said that I'd known some familiar faces, which made the transition, helpful. But what I think was most rewarding was going into a couple of meetings, and the entire conversation was just this: how can we do better, and what are we doing, and what can we do better? And to me, that was such an optimistic and hope-filled kind of focus that it kind of rubbed off on me. And working with good people allows me to have that hope, because I think, you certainly get into conversations about what resources do we have, what can we spend. But when you have that level of optimism and that level of focus on trying to, improve certain services, it's very fulfilling. And that's part of what makes my drive into work in the morning a little bit easier every morning. So it's nice.
I really appreciate it. Thank you so much for your time this morning.
Absolutely.
And thanks for coming on. And we hope to have you back.
Yeah, absolutely. Awesome. This is more fun than most of the meetings I go to, so I'll wait for the invite.
We'll take it. Thank you so much.
Thanks, Jonathan.
I really appreciate Jim for coming in and introducing himself to the community. He is a person who is very passionate about the work that Granite VNA gets to do. He is very well versed in all sorts of the issues that people might pull up in the community. And I think it's really fascinating to just hear, especially his last answer to if he won the lottery and he would just still be working, but from a nicer place. Like, that really stands out to me about who Jim is. He is awesome in that sense that he cares about his staff, his team, and making sure that the organization is thriving and doing good work. I think that stands out about any CEO. And I hope we have more conversations like this as we get this season started, because we're just getting settled, and we are so excited for the guests we get to bring to your ears or screens if you want to look at my lovely face. And this new season will be full of twists and turns and topics, but we hope you join us for every single one that we offer. So make sure that you subscribe to our channels, specifically on YouTube, because it's free to do. It's low effort, but it's going to make the most impact. That way we can get these conversations to the ears and the people who need to hear them. So if you aren't watching us there, you can still hit your subscribe button anywhere. If you're listening to this, go onto our YouTube at PPHNH and hit the subscribe button. Really, what's the worst that can happen? You can find us also at pphnh.org or on our socials at pphnh. Better Together is a partnership for public health production. It is written by me, Tessa, and Emma, which is why no matter how long of a meeting we take to write this, I'm still going to go off script and ignore what they said. Our producers are myself, Jonathan Lyle-Sexton, and Emma Peterson, with technical direction from Tessa Donahue. Thank you for being here, and we'll see you next time.